Hi, my name is Dr. Adam McCluskey. I'm a sports physical therapist working primarily with CrossFit athletes and weightlifters. So much of what I do is observing my athletes' movements and then helping them optimize their joint positions and their muscle activation patterns. So I've been using this Angles90 grip for a little while now, and it's been really beneficial to help facilitate that. And so what I want to do is talk about a few pathologies and injuries specifically that I've used the Angles90 grip to help facilitate and speed up the rehab of my athletes. So the first is called lateral epicondylitis. And this is going to be a pain that you have right here on the outside of your elbow. So it's called your common extensor tendon. And those extensor muscles run down the forearm and kind of help extend the wrist. And so this tennis elbow pain is usually caused by an overload of those muscles kind of at that musculotendinous junction. And so some ways that can happen is overloading those muscles and the tendon just in the form of some contributing factors are poor grip strength, poor joint wrist position or wrist mobility, and then poor shoulder stability. So a very common aggravating factor is going to be a forceful pronation and supination of the wrist. So turning the palm down, turning the palm up. So kind of anything that's forcefully moving that wrist forward and back can be an aggravating position for those athletes with tennis elbow. And so what the Angles90 grip allows us to do is, so say they're a barbell athlete and they're used to doing barbell deadlifts, their hands are going to be kind of in a forceful pronated position. And so if in that person, if that's a aggravating position for their elbow pain, what we can do is use this Angles90 grip to hook to the barbell, and now it allows them to be in a very neutral position of their wrist. And so they're not forcefully pronated or forcefully supinated when they're handling the barbell. They can be in a neutral position. And a lot of times that allows them to be in a more of a pain-free position and help them get back to training quicker without being sidelined from this injury. And so that's a big thing of if you're an athlete, or a lot of the athletes I've worked with, is being able to get back to training pain-free as quickly as possible, but also safely, is a huge goal. And so that's really been a key facilitator with using these grips to help do that. Two more things are carpal tunnel syndrome. So that's going to be really something that is going to be aggravated by a wrist extension. So it's going to be kind of some numbness into the hand, and then basically caused by compression of the nerve as it comes through this carpal tunnel, as it just kind of sits formed by some bones here in the wrist. And so an aggravating thing for that is going to be a real forceful wrist extension. So again, being able to keep the athlete in a neutral wrist position. So as they're going through, say it's a pull-up, they're able to kind of position their arm, shoulder, and hand however it's needed in a more neutral position, so that they're not forced into a kind of forceful wrist extension and aggravating those symptoms. So again, getting back to training as quickly as possible without aggravating those symptoms and staying pain-free. The last thing is a little less common, but is definitely something I see, is called Quervain Syndrome. And so there's a tendon that kind of runs here from the thumb, and it sits in a sheath, and if that gets very irritated, it can be painful. So a quick test for it is to kind of hold your thumb in like this, and then do an ulnar deviation motion, so pulling in like that. And so a lot of times people will, some lifters will pull from a barbell, they'll pull with a hook grip, so they'll kind of lock the thumb in, or just grabbing a dumbbell and pulling it off the rack can be painful if it's just really forceful through that grip and you're really pulling that thumb in. And so with the Angles90 grip, it allows you to still pull any kind of weight. So whether you're doing a pull-up, a barbell lift, picking a dumbbell up, you're able to grab that and keep that thumb in a neutral position, which a lot of the braces for Quervain syndrome will keep that thumb in that position. So it allows the athlete to still be in the gym, still training, and keeping that thumb and wrist and hand in a good optimal position to help facilitate their rehab and recovery, along with kind of helping them get back into the gym training as quickly as possible. So again, the Angles90 tool has been really helpful in my practice. I've been using it regularly, and I highly recommend it to you to try as well.